Hello guys, welcome back to my YouTube channel. So today's topic is how to take a history in a patient with vomiting. If a patient comes in, he can come. One thing we should know is the presenting complaint and guess where it can present. He can present in OPD, he can present in outpatient clinic, he can present in emergency. So with vomiting, most of the time the patient present in emergency. So what are the questions you need to ask? When did it start? How did it start? When did it start will tell you that it started, the patient will tell you it started 2 days back. So you will have an idea about the acute cases. But when the patient will say, I have, I have been vomiting for 3 to 4 months on and off, it comes and goes, and like this kind of history, so you will have a chronic disease idea. How did it start? This means that what you were exactly doing. Any triggering factor he will label that when I usually when I drink alcohol excessively, so it starts, and anything like that. So next question is, what were you doing when it started? So this will tell you that exactly the point where he felt the vomiting, right? Because it will give you a hint about since you can ask a patient that if he occupation matters a lot. If he is a magician or anything that certain jobs which revolve constant rolling and something like that, so you will get to know that it may be due to the rotational activity. How many episodes in a day? That's a very basic question. These 4 questions will give you hint about the acute or chronic cases and other idea. Now this is from this question there is exact elaboration of the vomiting. So how many episodes in a day? Usually the patient says, if he says that 2 to 3 episodes, so we will consider this a mild one. If a patient says that he had 5 to 6 episodes, so we will consider it a major case, right? So, and we will also assess the hydration level as well, because the more amount of episodes, the more patient will throw the bicarbonates, and acidity level will increase in the body. So we have to check for all this. Was it forceful? That's a very important question. That is projectile, non-projectile. So what does that mean with the projectile vomiting? That means that patient didn't have nausea before, and suddenly he just opened his mouth and he vomited. We will ask that was there any feeling of nausea before vomiting or not? So if not, it will be projectile. If non-projectile, patient already has nausea feeling, right? So mostly seen in gastroenteritis case and food poisoning, you have vomiting. So this will give a big hint about the diagnosis. What was the consistency? So that's important. It was watery, it was food content, or what was it?